virus.
That was Gavin Newsom. Let's go now to Capitol Hill and speak to Democratic Congressman from California, Ruiz, who is also a doctor. Congressman, thank you very much for joining us. Let's just talk about that case because it's getting a lot of attention here in the States today. Why are people looking at this as something new?
Well, we're looking at this as something important because most of the cases that have been diagnosed here in the United States are from travelers from outside of the country. The fact that this is a unknown transmission, which very well may have been a person-to-person transmission that we had no clue where they got it from, is a new episode of the virus spreading within the United States. And so that's why it's important that they do the contact tracing as rapidly and thoroughly as possible.
And I guess this is why the WHO today is saying, look, we're in this decisive phase of the virus and government has to act swiftly. Do you think the US government is acting swiftly enough to try to contain the outbreak here in the States?
Well, here's the good news. The good news is that we've only had 60 cases, there's been no death, and there's possibly 3 person-to-person transmissions. So right now, the damage is very, very low. However, what's concerning is that it's not a matter of if, or it's a matter of when this virus was spread from the inside. And so when you're hearing mixed messages and discrepancies within the administration and the leaders who are supposed to be in charge of this, it doesn't breed much confidence in their ability to efficiently prepare for this. If we're not explaining to the American people what to do in case this gets out of control, then we're not really preparing the American people. So what we want to do is to ensure that people understand that this virus, we can prevent this virus from spreading if you wash your hands repeatedly, don't sneeze or cough on people, and make sure you keep an eye on the most vulnerable, which are those with illnesses, those that are the elderly, and start making local plans within your homes, your schools, and your counties, preparing for the worst but working for the best. That's the motto. That's what we should be aiming for, and let's get it done.
Congressman, this is becoming intensely political now. We've got Mike Bloomberg, the Democratic candidate. He's out with a new attack ad called Pandemic. He's criticising the president. The president, in turn, yesterday in the briefing room, saying that Democrats are trying to use this to attack him. At some point in the next few weeks, they're going to have to agree a budget in Congress. Can they do that? Can they get the president to sign it?
Listen, yes, I believe he'll sign it. This morning, my prayer was to help the president, the vice president, and all the administration get their act together for the health and safety of the American people, which could come first. Damn politics, damn campaigns. What's important is the health and safety of the American people. However, it is important to point out the facts that President Trump's proposed budget cut $700 million in the CDC, the very same people that are supposed to help keep us safe. He's fired CDC experts in this realm. He's left very important pandemic experts within the National Security Council, Department of Homeland Security positions very vacant, and he disbanded the Office of Pandemic Response. So these are decisions that have not helped in this case. So what we need to do is we need to be straightforward. We need to provide a robust funding package, but you can't just fund dysfunction. You need to fund a functional system that's coordinated, efficient, that educates the American people, is honest, consistent, that is not alarmist, but at the same time is smart in preparation. Because when you're trying to figure it out during an epidemic, you're too late. And right now we haven't reached that threshold, but we very well could. So let's take the time to prepare in our homes, our schools, our governments, our states, to make sure that we're prepared to minimize or mitigate the amount of harm this is going to do to the American people. Now is the time.
Mr. Ruiz, you are a doctor and you are a politician. You are in a perfect position to tell us whether we should be nervous. How worried are you?
Yes. Yes, listen, I am making the preparation. The best thing to do about anxiety is to feel empowered and in control. So I learn and I'm studying about the virus, I'm educating people, I'm having discussions with my wife. If this spreads and we need to do voluntary quarantine with our children, I have two 5-year-old girl twins. They're 4, they're going to turn 5 next month. But what do we do in the case if a parent needs to stay home with the children? What do we need to do if a school needs to be shut down? Those are conversations that we should have that shouldn't be alarming, but it's good to have so that we're prepared. And that's where I'm at right now. And also looking around to see the vulnerable individuals in the communities that will need special attention. It is the time to talk to the hospitals and the healthcare systems in your communities to determine if they have a plan for quarantine, voluntary quarantine, for identification, isolation, and containment within your location so it doesn't spread, and to have enough supportive equipment within a community like IV fluids, masks, etc.
Congressman Raul Ruiz, thank you very much